Then comes the SPRINT trial. SPRINT is a trial for patients, pre-symptomatic patients, and they must be less than 42 days. Um, SPRINT has included patients in the US and in the EU, and it's a trial for patients with 2 or 3 copies of SMN2. What can we take out of the data that has been presented by SPRINT for SPRINT? We can remind that patients with 3 copies of SMN2 treated before the onset of symptoms so far are normal. And patients who are with 2 copies of SMN2 treated by the gene therapy, 50% of them are normal and 50% of them have some kind of motor delay. So that's the data that I keep from SPRINT. This is, of course, completely different of STRIVE and even of START. This data, these patients are doing much better than patients from STRIVE, which confirms that if you want to get the maximal benefit out of gene therapy, the same applies than nusinersen. You should treat early and you should treat before the symptoms. So, STRONG study is a study of intrathecal gene therapy that was conducted in patients with type 2, older than 6 months. And interestingly, this study was put on hold for preclinical findings in the non-human primates, in which toxicity in the dorsal root ganglia was described. And so there was a poster for the safety in patients of STRONG. And fortunately, there was no safety concern similar to the preclinical findings in non-human primates. So this is a really good news.